Hello, welcome to my YouTube channel. My name is Felgona, and this is Skincare with Felg. In our first episode of skincare, we looked at some of the conditions that affect the skin, and our desire is to jump into the products. But before we get there, I would love us to cover something that is also very important. That is the skin type. So in this episode, we are going to cover the different skin types and how to know your skin type. So you might be wondering, Felgi, why do I need to know my skin type? Or why do we need to cover this episode? The answer is simple. When you're taking care of your skin, that is, you want to take care of the conditions you mentioned in the first episode, there are products that I may use and they will work on me, but they will not work on you. So you're like, okay, why is it working on Felgi and not on me? It's simple. Probably because we have different skin types. So different skin types, they each have different needs and they react to treatment differently. So it is very hard to get a single product that addresses the same issues in all skins. Okay, they are there, but it's hard, especially if you're going to have a routine. The routine of a person with, let's say, something like normal skin cannot be the same with a person with dry or oily skin, because the skins have different needs. So that's why we are covering that. It's just a way of understanding what your skin needs, and after understanding what your skin needs, it becomes easier for you to specialize in the type of routine that is suitable for you. So we have 4 common types of skin types, and the 4 are: 1, we have oily skin; number 2, dry skin; normal skin; and combination skin. So I'm going to get into all of them. I'll start with oily skin. So oily skin, this is a type of skin that, as the name suggests, it looks oily, or let's say it appears greasy, and generally it looks humid, and if you take a very closer look, it looks porous, and it also feels greasy. It feels greasy, and it is as a result of the skin producing excess oils. That is the sebaceous glands that we mentioned. The sebaceous glands produce excess oil, so the skin appears greasy. And for this skin, the most common conditions that affect it are mostly acne, and then as the acne heals, what remains is hyperpigmentation. That is the scars left behind from the healing acne, hyperpigmentation. So mostly they will suffer, or they'll experience a lot of acne, the different types of acne, and hyperpigmentation. And then the second skin type, we have dry skin. So dry skin, this one, it appears flaky, or it appears as if it is peeling, and in some cases it appears powdery, and then it feels stretched and tight. It's like something is pulling your skin apart. Mostly it's not hydrated, it's very dehydrated, and as the name suggests, it is dry. It is just dry. And then for it, it's because mostly, okay, you'll have small pores. For people with dry skin, you have small pores, and then the production of sebum is a little bit low. So mostly people with this skin type, what they experience, or the condition they experience mostly, is scaly skin. They experience a lot of scaly skin, and then since the skin is a little bit stretched, sometimes they experience cracking, and then the cracking, it exposes the skin to bacteria. and so they might also have swellings, and then as the swellings heal, they will have hyperpigmentation. So mostly they experience a lot of scaly skin and a little bit of hyperpigmentation. And then the third skin type, we have normal. So normal, as the name suggests, it's normal. I can say it appears soft and clear and well hydrated. They don't have blemishes. It's almost flawless. And for normal skin types, they are not affected by external conditions. They're not easily affected by external conditions. Their skin is can I say healthy? Yeah, it's healthy, it's good. They rarely have conditions or problems with the face, and they really don't have to invest so much in these skincare things, although it is important, but generally they don't have any serious things that need attention for their skin. And we're not saying that they cannot get acne. They can, but it's not something that is common. It rarely happens. And then for the fourth category, we have combination. So combination, this is a type of skin where it is not it is a mixture of oily and either dry or normal. So this is how it happens. For combination, we have what we call the T-zone. So the T-zone is this part of your forehead, the forehead, then down to your nose, and this cheek area around the nose, up to the chin. So that is the T-zone. So the T-zone is oily. And then the remaining part of the cheeks, we can call it the C-zone, this part and somewhere down here. That is the C-zone. It is either normal or dry. So a combination can have a combination of either oily and dry or oily and normal. So how do you know your skin type? So knowing your skin type is easy. It's something you can do it at home wherever you are. So what you do, the first thing is you are going to wash your face. But before you wash your face, first of all, ensure that the conditions under which your skin is are normal conditions. Normal in the sense that you've not worked out. Like, sometimes immediately after working out, if you wash your face, your skin or the cells in your skin are still active. So they might be still producing excessive fats and sweat and all those things. So ensure that your skin is at rest. You're not from working out, one, and you have not used a harsh product recently. You're just at a normal state. So after you've ensured that you're at a normal state, you wash your skin. And as you wash your skin, make sure you use a very gentle cleanser. And then use water at either room temperature or lukewarm. So don't use excessively hot water. It's not good for the skin. And then don't use excessively cold water. So room temperature, lukewarm room temperature, preferably lukewarm. And then you will wash gently, and then you dry it gently. After doing that, do not apply anything on the skin. So just wash and then don't apply, and make sure your cleanser is gentle. After doing that, ensure that you sit under normal conditions. Don't go out in the sun. When you go out in the sun, you're going to be exposing your skin to a lot of things, and then it might try to protect itself, so there will be overproduction of things. So just ensure you're sitting under normal conditions. There is no sunshine there or excessive sunshine. And then number two, there is no wind. You have not turned on your AC. Like, the temperature is normal, the conditions are normal, so the environment is not dry, it's not excessively humid or sunny. So once you are under such conditions, you will stay with that skin, the one that you've washed, and not applied anything on. Stay with it for 30 minutes. Stay with it for up to 30 minutes. Then after the 30 minutes, the next thing you're going to do is to examine the skin to see how it is like. So you can either do it just by looking or you can get some things to aid you. So if you're getting things to aid you, you can use something like blotting paper. If you do not have access to blotting paper, you can use tissue paper. But if you're going to use tissue paper, ensure you are using very soft tissue paper. I've noticed that the pocket tissues are a little bit softer, so you can either use Fay or Velvex or even Hanan, just the pocket tissue. You can take a single ply, and then you will pat it on your skin. So you're not wiping, you just pat. So after patting it, you'll pat it on every part of the skin, that is the nose area, the forehead, and the cheeks, and even the chin. Now, for those who are using tissue paper, you will observe the tissue paper. You can put it under light. If the tissue paper appears greasy and it has a lot of oil, that is the tissue paper that you have applied in every part. You've pat in every part. So I'm assuming you're going to use a lot of tissue paper, one for your nose, one for your forehead, one for the cheek, and another one for the chin. So if the oil is much, then from that is much in all the areas, forehead, nose, cheek, then you have oily skin. If you observe it and the oil is very little or not there, that is from both parts, the oil is little or not there, and the skin itself feels comfortable, then you have normal skin. But if you observe it and the oil is very little and not there, yet the skin feels tight and stretched, then you have dry skin. If you observe it and you notice that the skin, the part of the tissue that was in contact with the nose and forehead and the chin is a little bit oily, and then the part that was in contact with the cheeks is not oily, then if the part that was in contact with the cheeks is not oily and the cheeks feel comfortable, then that is combination, but combination of oily and normal. If the part of the cheeks feel dry, then it is a combination of oily and dry. Another way of observing it, let's assume you're not using the tissue, you can just look into the mirror. So for those with oily skin, you'll notice that your skin appears as if you have a salad, like a layer of salad on your face. If it is not that much, okay, you can notice, you can see the oil, a little bit of grease. Then if you observe it so close, you will notice that you have pores that are slightly bigger. You can really see them well, the pores. For dry skin, the pores will be slightly small. Then you can see that you do not have so much oil on your face. It looks tight and stretched. In some extent, you can even have some lines showing that it wants to crack. Then for normal skin, you look at it, it will just, you'll feel comfortable and it will look okay. It's not looking oily and it's not looking dry. That is normal. And then for combination, you will see the pore area, the T zone will have a little bit of pores, then it will look a little bit oily. And then the cheeks, like we said before, it's either they're dry or they're feeling comfortable. So you can do that so that you know your skin type, and then from there it's going to be easier to know the type of products that you should use for your skin. And then as you do that, it is important to note that our skin types, they vary. It doesn't remain the same like throughout your entire life. So you cannot assume, or you cannot say that now that I have found out that my skin type, for example, is normal, so the product I've been using, I'll use it for the next 10 years. A lot of things happen in between and they can change. So after a period of time, you can keep on checking to find out, has your skin type changed or is it still the same? So factors that cause the skin type to change, we have things to do with age. Age, for example, you can find when a child is born, during their early stages of growth, they might have normal skin. Then as they approach teenage, the skin becomes a little bit oily. It can remain oily all the way to ages 30. Then beyond 30, it starts drying. So age is a factor. You'll notice that as you age, your skin type changes. And the reason why your skin dries when you become old is because now your activity has reduced, and even the sebaceous glands are producing less oil. And then Another factor that causes skin type to change, we have seasons, that is climatic seasons, that is the weather. If you stay in a place, or for example it is a season where the weather is a little bit humid, let's call it summer, it's a little bit humid, you'll find that your skin will be oily, and then as time goes by, then it becomes dry, then your skin will also be dry. So if you are staying in a place that was humid, then you relocate to another place that is dry, it can also affect it. When you are still in the humid place, your skin was oily. When you relocate to a dry place, over time your skin becomes dry. And then sometimes the type of medication you use, if you are in a type of medication for an extended period of time, some medications will either dry your skin or cause your skin to become oily, depending on how they alter your hormonal functions. So for skin type, this is something that you have to keep on checking, basing on the conditions that you expose yourself to. And then there's another issue, we have what we call sensitive skin. So okay, some people think their skin type is sensitive, but sensitive is not really a skin type, it is more of a condition. And with sensitive, it means that the skin is easily affected by external factors. And the reason we're saying it's a condition is because you can have normal skin that is sensitive, or you can have oily skin that is sensitive, or combination that is sensitive, or dry that is sensitive. So this one, sensitive, mostly doesn't last. It could be because maybe you expose yourself to too much heat, or you use the harsh product, or you're on some medications that have made your skin a little bit sensitive, just cause a little bit itchiness and burning. That is the sensitivity part of it. So mostly it's just a condition. It can be cured, or sometimes it persists, but it's a condition, it's not a skin type. So I hope you're going to take the test, and then from there we will move forward to the products that are good for you according to your skin types. Thank you so much for tuning in. I'm looking forward to seeing you in the next episode. Until next time, take care and bye bye.